COVID-19 restrictions will be relaxed come Monday, March 7th, as new measures will go into effect. The measures were announced by Prime Minister Dr. Keith Rowley in the House of Representatives on Friday. Mahalia Joseph-Wharton has more.
Now in the endemic phase of the COVID-19 pandemic, Prime Minister Dr. Keith Rowley listed the public health measures that will be eased. Among them, public transport resumes at 100% capacity. Families will no longer be required to be masked while in their vehicles or vessels. The removal of restrictions with respect to the length of time and number of people at religious places of worship and the number of people permitted at graveside funeral services will be unrestricted. However, mask wearing remains mandatory. He added that safe zones for vaccinated or exempted persons and children under the age of 12 will be allowed to operate at 75% capacity.
For unvaccinated nationals returning to Trinidad and Tobago, a reduction in the quarantine time would be applicable. Quarantine time will be reduced from 14 days to 7 days, with discharge taking place on the receipt of a negative PCR test on the 7th day.
The Prime Minister said the national quarantine time for contacts of positive cases will be reduced from 14 to 10 days and the isolation time for positive patients from 21 days in all categories to 10 days for persons with no symptoms and 13 days for those with moderate to severe disease. As it pertains to public gatherings, Dr. Rowley said the number of people in groups of no more than 25 is now permissible. Team sports and contact sports will also recommence.
Provided that we do not have dangerous changes in the COVID-19 position, we will permit all children to return to physical schooling in term 3. The Ministry of Education will continue to put out the necessary guidelines to safely manage this process. As of Monday, 7th March 2022, the public service will return to full service and all public servants will be expected to return to work as normal.
Additionally, the Prime Minister said the Ministry of Health will be presenting a national pathway for the consolidation of the public health service that would see the return of the health system and, by extension, health services.
A structured, risk-based approach will be adopted to gradually reduce the footprint of the parallel healthcare system and regularizing the hospital system. The proposal will be implemented on a phased basis based on real-time risk assessment starting with point 14.
He said the Minister of Health will give further details next week. Mahalia Joseph-Wharton, TTT News.
In more news, there are 21,739 active COVID-19 cases in Trinidad and Tobago. The Ministry of Health on Friday reported 345 new cases of the virus from samples taken between February 27th and March 3rd. 7 more people succumbed to the virus in the past 24 hours, taking the COVID-related death toll to 3,649.